Hello, leaders of the world. Welcome to Spread Love in Organizations, a podcast for purpose-driven healthcare leaders striving to make life better around the world by leading their teams with genuine care, servant leadership, and love. I am Naji, your host for today's episode, joined by Dr. Mady, a physician, scientist, healthcare consultant, serial entrepreneur, and a brilliant innovator. Ahmed Mady is currently pursuing his executive MBA at MIT Sloan in Boston, while serving as the managing director of his family textile business in Egypt. Prior to this role, he worked as the senior director of business development at an innovative Boston-based diabetes management startup, Healthimation, and as a senior consultant at Navigant Consulting, where he led numerous global life sciences and healthcare projects for pharmaceutical companies, Medtech, and Biotech space. In addition, Dr. Mady has experience conducting translational research at the Cardiovascular Research Center at Harvard Medical School, Mass General Hospital. His lab research is focused on stem cell applications in heart diseases and diabetes, where he created human cardiac tissue engineering models. He earned his medical degree from Alexandria University in Egypt with several rotations in the United States. Ahmed has over 14 years of experience in healthcare business, manufacturing, medical research, and technology management. Welcome, Ahmed. I am thrilled to have you with me today.
Thank you so much, Naji, for the introduction, and it's my pleasure to be with you on your great podcast.
I would love to start by knowing you a little bit more about your personal story. What took you from your childhood in Egypt to medicine to now becoming a serial entrepreneur and a student at MIT? What's your personal story behind it?
Well, I can tell you it all started back when I was 40 years old, when my father wanted to teach me the tricks of a trade. My father owns a textile factory in Egypt. And he wants actually to just make me get involved with him in the factory. So I used to go to the factory and just play as a kid. And when I was 10 years old, he made me work on the factory floor before moving me to a cushy desk, managing the entire business with him when I was 16. During that time, I had a great experience with the workers and employees of the factory. And I can tell you this great experience with the 500 workers had a profound impact on my life, teaching me many lessons in medicine, in consulting, and in manufacturing, and most recently startups. So when I was working in the factory, everybody was expected that I'm gonna just follow my father's footsteps, and I will enter business school. I will be managing the factory after him. And when I was working with the factory, I felt that all the underprivileged workers and people, they really needed something in healthcare. And one of the biggest challenges we were facing is the lack of adequate healthcare in the country. That made me become more interested in medicine, become more interested in science, and I just decided to enter medicine. So during that time, I was working in the factory during the first couple of years of medical school, while also going to medical school and studying medicine. And I decided that I really wanted to focus on the healthcare sector. And I finished medical school and got a scholarship to go to the United States to do my internship year. And I would say the rest was history, just continuing my healthcare career for more than 12 years. Until I got a call from my father in 2018, telling me that he wasn't feeling very well, and he was thinking about shutting down the business unless I'm willing to go back and help out. There was a lot of mounting losses because of the market, and from health perspective, he wasn't feeling very well to continue managing all the employees. It was a really tough call at that point that I had to make a decision whether I should continue my healthcare career in the United States or go back to help out and save the business.
Wow. And obviously you went back and you're working now and you're leading, right, the textile business of the family, right?
That's correct. It was a very tough call I had to discuss with my wife during that time. how we would make it work. We have two beautiful kids. They were in school in Boston. My wife was working in Boston, and it's very hard to really do the transition and come back to the Middle East after we established our careers. So she was very supportive, and we made the decision that I'll be spending 2 weeks in Boston, 2 weeks in the US until I can figure out a model that the factory can be managed remotely. So since 2018, I've been traveling between Egypt and the United States until COVID happened, and that made me get stuck in Boston for a couple of months until we reopened the airports. So
and now you're back, right? Like you're between Egypt and Boston again. Like we're talking together. You're in Egypt today.
That's correct. So during that time, I just wanted to strengthen my business acumen and learn more about the business fundamentals. And I made a decision that during my 2 weeks of staying in Boston, why not just get an executive MBA out of it and learn more how to really do what I'm aspiring to do, which is how to put a system in my factory that I can manage remotely while going back to the US and focus on my other endeavors.
It's awesome. And how did you, like I feel this healthcare never left you. I know you even co-founded 2 startups during the pandemic, so that are somehow touching the textile. You've done masks to heroes. You have another startup potentially you want to talk about also for sanitizing. Like there is something around this entrepreneurship that you have in your I don't know if it's in your DNA, in your blood, but you have this while also having this healthcare in back of your mind. Tell us a little bit more about these journeys and what you've done is impressive last years and building companies now that answers. And again, it helps. Obviously, you shared the employees in the beginning, the society where you felt healthcare needs a little bit more of support in that region and globally. So tell us a little bit more like this common thread that you have in all the different adventures that you're on.
So for my entrepreneurship journey, I would say it all started when I was very young, and I really liked the business. I wanted to start something, but starting a startup is not an easy thing to do, especially if you have family, if you have commitments. You really need to have some sort of security to be able to put some food on the table. So when I made a decision to go back to my father's factory, I still have this huge interest in healthcare and coming up with ideas. But I can tell you honestly that the moment I went back and I moved from the steady job to managing a business, I just felt freedom. I really don't really need to report somebody. I don't need to go back and work towards a promotion or make sure that my review will come, pretty great, so I can get a raise in my salary. It just felt freedom on my end. And this freedom gave me the option to really think out of the box and made me think about what else do we need. During the pandemic, when we were faced by a huge shortage of medical supplies and masks, I put 2 production lines in my factory to produce masks. And when we faced shortage of chemical sanitizers, I came up with a small device you can attach to the back of your phone called the utilizer, utilizing some technology that I used during my lab work at Harvard, utilizing ultraviolet C technology to kill viruses and bacteria within seconds. So I can tell you that the main thing in order to really tackle problems is to free your mind and make yourself think out of the box without any limitation, thinking that you really need to report to somebody or work towards the promotion or keep food on the table.
It sounds, Ahmed, it sounds so simple when you say it. It's just so impressive. Like you found a problem that was a public health problem with face masks. You found a solution, and it's not only business. I know for each mask that you were producing, you were giving back a mask for healthcare providers, and the sanitizer. Like this is such a great idea that can help us all save. So it's just amazing how you have always this healthcare with business, so with good also behind it. It's really great to hear this. I want to double down on something you shared in the beginning. 16 years old, working with 500 employees. You said you had life learning, managerial and leadership experiences that you took. I'd love to hear more about this and how you took this in a startup world, in the healthcare, while leading today a manufacturing textile business with, again, more than 500 people working for you. What are those things that as a teenager you learned and that you are definitely keep on doing it as a executive today in the healthcare world?
That's a great question, Naji. I will say that it really came down to my father's philosophy. When he wanted me to learn about business, he put me on the factory floor and working with the employees, eating with them, talking to them, understanding their language was this huge, has this huge impact on how I learned to do things. When we learn things in business school, we learn how to really put strategies, how to execute on a strategy, how to do some operational management. But what's, I would say, more important before even learning all of this is understanding the language of who you are working with, understanding their culture, their thoughts, and understanding what they think about the place and why they are here. And just by being around all these workers, that taught me a lot of things that I carried forward when I was, when I started managing the business with my father. So forming this great and strong relationship with the workers when I was super young, when I was 10 or 11, made them feel that I'm not a manager. I'm not somebody different than them. It just happened that I'm the son of the owner, and now we are working together to achieve great things for all of us. And instead of thinking that, yes, you're a manager and I'm an employee or I'm a worker, no, we are here for just one goal, is to do something great that will make all of us happy, that can make us feel that, yes, we accomplished what we're working towards. At the same time, there's some return that will make our life better. And just understanding this, very simple things will make people really work with you as great team players instead of looking at you as a manager and an employee.
Creating this culture, right, of care, of you're all together working, you said, towards a common purpose, obviously making things great.
And understanding their pain points. So when you work with somebody, so for example, like when you're working and understanding that there's a huge need for healthcare, and you start talking to them about, okay, let's secure some good healthcare insurance companies that can really help, if any of you or your family members, get into any issue, do you really understand that you're not here to make them work harder so you can get richer or make more money? You're here that for the purpose that we are all working towards better living. And when you work in a textile factory or a textile business, it's very hard to tell somebody, yes, we are here for great cause, because you're just building products. It's an economy of scale thing, where you are manufacturing some goods, you're selling these for X amount of dollars, you're paying the salaries. And it's very hard, when you explain to somebody why you're doing this. It's just a very simple, business. Comparing this to healthcare or to vaccines or to do something where you can really inspire people that we are doing this to save the world. So understanding their pain points, just feel these pain points, be a good human being, just the empathy, being empathetic with them, that can really carries a long way in managing a business and just doing great things with people.
And Ahmed, we shared while we were discussing before, there was the pandemic, there was also a moment, an unfortunate moment recently in your plant that you lived with your people. And I'd love to go into this concrete example because it really shows what you're talking about, how you cared about people and where you drove them towards this bigger purpose as an organization. even though, yeah, sometimes in healthcare it's easier, right? Like we're living to save lives or to make people's lives better. But you too, like you're managing them with care towards this purpose that you created, this culture of purpose that you created. So I'd love if you can tell us a little bit more this concrete story and how, as a leader, you went through it and you're back into an amazing, continuous growing successes.
Sure. So during COVID, let me start by COVID. COVID was a very challenging time that when COVID happened, we started getting cancellations for the majority of our orders. You know, stores were closed. Our clients said that we are not working and they started canceling orders. And we started seeing all the factors around us, pretty much the majority of them, laying off people, saying that we don't have work, we need to shut down, or we need to put a pause, you know, until things will go back on track. And the way we thought about it is how we can actually go through this challenge all together as one team without affecting anybody. And from a medical background, I realized that there will be huge need for PPEs, you know, and masks and patient gowns and doctor scrubs. So I start pitching actually the first idea to my classmates at MIT, saying that I'm thinking about making masks out of fabric. And that was even before, you know, people were like just thinking about, you know, these fabric masks as a normal thing. And I was thinking about two things. The first one, there will be huge shortage for medical supplies, and I'd love to help out in this. The second, how can I actually make my workers, you know, continue to work? How can I support them? How can I make the factory, keep the factory open during this pandemic? And that helped a lot. You know, we managed to really make thousands of these masks and sell them and keep everybody's job. We didn't lay off any single employee. And that thing, you know, when workers felt that, oh, we have been working in this factory for years and other workers in other factories were laid off or they lost their jobs while we still keep our job, that made them feel that we are literally working as one family and not just as, you know, as a business. It's a family business. We are dealing with everybody as a family. Then, you know, COVID happens. We were going through COVID, and then we were faced by another big challenge. And I would say this was the biggest challenge of my life, where back in January, in the morning at 11 o'clock in the morning, we had a huge explosion erupted on the top floor, and a huge fire happened on our in our printing house. During that time, I was actually at the nearby bank. I got a call from one of the employees screaming over the phone saying that I had to really go back immediately to the factory because the factory is on fire. And during that time, you know, I tried calling many people at the factory. Nobody was picking up. I tried calling my dad. He wasn't answering the phone. So I had to rush to the factory. And during that time, I just found five trucks standing in front of the factory, hundreds of our employees outside of the gates. And we're saying that we still have a dozen employees on the top floor that are still trapped. I just couldn't feel myself. I just ran, you know, towards the top floor, and I asked the firemen if they were able to really rescue them. They said that they were facing some challenges getting, you know, knowing the way. So I just had to go up with them and figure out, you know, how I can help. I showed them, you know, the shortcuts, and we spent pretty much the next 20 minutes putting down the fire, and we were successful in getting everybody out except one employee that we unfortunately lost during that fire. You know, it was a big tragedy. It was a huge tragedy on everybody, and it was just a shocking experience that we had to deal with. The next day, there were a lot of things that we had to do to really bring back the team together and get the production up and running. One of them is just allowing people, you know, to mourn and to listen to all of them and see what they want to do. There are a lot of details here. I don't want to, you know, continue the details, but I would say, to summarize the experience, having a huge, shocking experience like that will test people's internal motivation and people's morale and morals. And I can tell you that the majority of our employees really did an amazing and outstanding job in just working together and getting the whole factory back into production very, very fast. I was surprised to see our workers working 15 consecutive days without one single day off. I was also surprised to see that nobody was asking for any, work and not asking for any overtime or anything like that, despite the fact that at the end, they got all their salaries, full salaries and with the overtime. But I felt that people were really acting as one family, and instead of just taking advantage of the situation.
Ahmed, you led the way. Like it's impressive. You went in, you were in the fire, you went with the firefighters, you went there. They saw you, right? Like I think you're such a genuine, caring leader that this is why they are showing up. Like it's really this culture as you shared in the beginning. And thank you for sharing again this painful experience, but showing again this genuine care and leading with your heart makes people strive for whatever purpose they are on and for the company they work for. Thanks Ahmed again for sharing this with us.
Thank you for the nice words, but I really want to give the credit to all the team. It's not me. I just act, as a human being, not as a leader, or as, I would say, like, not as a manager. And just everybody was working towards, getting this whole factory. They told me, this is our second home, and we can't let our second home go like that. And it was a very humbling experience.
Well, with this, I'd love to jump now into another section where we're gonna play some sort of a game. I will giving you one word, and I'd love to hear your top of mind thoughts. So the first word for you is entrepreneurship.
Freedom.
Tell me more. You shared a little bit in the beginning, but I'd love to hear what you call freedom.
Freedom, innovation, leaving your impact on the world, creating jobs, coming up with something very new and making it happen, turning ideas into reality.
Great. What about disruption?
Disruption. Thinking differently, advancing the world, and leaving a dent in this universe.
I'm gonna say OP.
OP. It's very important. Organization processes is very important. Having the three lenses, where you have the strategic, political, and cultural lens, is a great way of leading your organization. It's very true that a lot of lessons that we learned in OP, you can apply practically and not theoretically on the ground and see their effects pretty quickly, including having a buy-in from your team to change an organizational behavior, including anchoring an idea in somebody's mind or in the team's, your team, and making them work towards this idea. Just working with your team and trying to lobby for a specific goal or a specific action. So it's OP all the way if you really want to create a good culture and lead your organization in a great effective way.
And to finish this section, what about spread love in organizations?
It's very important. Spreading love. Love is humanity. Being a human is what it takes to really have a great organization.
Great, and I want to end this with a shout out for your work with Mask to Heroes, as the pandemic is still here and we're still living it every day. So a shout out for everyone hearing us to go and get masks and help out also the community, to give back also for the community and for so many healthcare workers who are on the front lines.
Thank you.
Moving.
I want to actually give a shout out to all the MIT and the colleagues who made this idea happen. Without their help, Mask to Heroes would just be an idea, but everybody jumped on the board and we turned an idea into a reality in 2 weeks. We started selling thousands of these masks in 2 weeks, and that was because of the help of the whole class of the executive MBA at MIT.
Very nice. Ahmed, moving forward with, from the 16-year, and even you said 10 years old to healthcare, being a physician, working in care, and then leading now the organization and different companies. How would you continue, spreading love in organizations? As you said, this is the key point of a human being, right? How looking forward, what would you take from all your learning? And now that you're here and you want to keep on growing, I'm sure the different businesses that you have.
Sure, I would say by continually learning, from your colleagues and from employees and clients in any organization. And to learn, you need to listen. You really need to have active listening, not just listen, and learn about what makes people happy in an organization, what makes them love this organization, how can you increase, spreading this love, and most importantly, just showing empathy, being a good human being, always care for the people, and people will care for you.
You talked about a lot about leadership, about the impact of your father, who told you very early on. Any leader, in around you that inspires you and that you look up to and helped you during this leadership journey that you're
on? Many leaders. The first one, I would say, my father is my role model. There are a lot of leaders that you actually take. So every leader has actually a great strength in one point, and I love reading about all entrepreneurs, from the famous entrepreneurs who are currently among us, Jeff Bezos, Elon Musk, and all those people. They're great on specific things, where they made their organization tremendously successful. And there are other leaders like Tony Tony Shea of Zappos, who created a great culture, and Bill Gates, and all these great names. So it's a learning experience, and I continue to learn every day from all of them.
The patchwork of different strengths that each of one has, right? You talked about reading. Any top of mind book you have for our audience to read these days?
I really like, I would say, The Power of Habits. That's one. Drive is a great one. And when you really try to understand the social norm and the market norm, there is a great book called Predictably Irrational. It's a great one about understanding how people think and how people can help each other. It's a great one.
Any final word of wisdom that you have for the students, around you, or the entrepreneur in healthcare specifically? Any final word from you?
Well, I continue to learn from all our colleagues, from you, Naji, and from all our amazing colleagues. And I consider myself a student, of life. Continue to learn every day. The only thing I can share, here as final words, just being a good human, is the shortcut to great leader. That's one thing. The second, I would say that when you work with people and you talk to them, people will always remember how you make them feel, not what you tell them. So be mindful of your words and how people can, how people feel after you talk to them. And there is a lot of humbling lessons that I learned during this, fire crisis. And I continue to learn from every day from our employees and from everybody around me.
Be a good human is a shortcut to be a great leader. It's so powerful. I want to end with this sentence. And thank you so much again, Ahmed, for being with me today and for this genuine discussion. You shared such inspiring stories for us all to continue leading with genuine care and love for a better healthcare around the world. Thank you all for tuning in today. Follow our podcast for more inspiring stories from global leaders in healthcare. New episodes are released every other week. Be on the lookout and stay connected. Follow, subscribe, leave a review on Apple, Google, or Spotify. Most importantly, spread love in your organizations and spread the word around you to inspire others and amplify this movement our world so desperately needs.
Thank you so much, Naji, and thanks everybody.